Welcome back to News 3 at 4. Well, today we're talking about women's health, and that topic often underfunded and underdiscussed. Well, May is Women's Health Month, and as experts try to change the trend I just mentioned, today we're joined by a physician's assistant from right here in our region to address several of the common misconceptions in that healthcare space. Now, this is Destiny Petrowich. Destiny, thank you for joining us today.
Thank you for having me.
Yeah, of course, and you're with Premier U. I know that,
Yes.
being a woman and an expert, this is something that we can definitely get into. And let's get right into it, if you don't mind. Let's talk about that underfunded and underdiscussed part. Now, what about that issue?
I definitely think that, the biggest reason why you don't hear a lot of talk about menopause or hormone replacement therapy, it's because of a study that came out in 2002 by the Women's Health Initiative that showed hormone therapy is dangerous. And we saw an immediate decrease in the amount of hormones that were prescribed.
Yep.
Providers got scared, patients got scared,
Sure.
and over the last 20 or more years, that study has been debunked.
Okay.
It has been proven, that there were problems with that study, and now we know that we can do hormone replacement therapy, very safe. And menopause is something every woman is going to go through, right? And unfortunately, there's not a lot of training when you go to medical school and on how to do that. And so I'm here to advocate for women, for Women's Health Month, about hormone replacement therapy, because it is such an important part of women's health.
Well, as you mentioned, the hormone replacement therapy, part of dealing with menopause, the symptoms of menopause, and a lot of women do have to deal with that. Well, let's talk a little bit about the symptoms of menopause and kind of those triggers to let ladies know this is something that we need to be thinking about.
Yeah, so often, we think menopause, perimenopause, those words are, well, it's right before I never have a period again. Right.
Well, I think there's a lot of stigma associated with it as well.
Yeah, right. People don't want to talk about it. It makes them uncomfortable. And, the studies show that women experience hormone changes up to 10 years before they ever have their last period, right?
Okay.
So, on average, that's women in their early 40s. That start to experience this. And so, it's sometimes vague. It's fatigue or abnormal weight gain, sleep disturbances, just I don't feel like me. Right? And a lot of times we see that getting masked with anti-anxieties or antidepressants or, and when the root problem is hormones. And so, a lot of that is just due to the lack of training. But it's really important for women to advocate for themselves, find a provider who specializes in it, because it can be done safe and it can be life-changing.
What are some of those mega symptoms that women should look for?
Oh gosh, I see more often than not people coming in, they say, all of a sudden I'm angry or I'm irritable, right? Or like on a snap, I'm mad at my kids, right? And that's not me. Or, like we said, the depression or anxiety, and they say, I'm sleeping, but I'm still tired. What can I do different than what I'm doing?
Well, like you said, it's kind of like not even being comfortable in your own skin anymore. And I feel like ladies in your 40s, that's when we start to get comfortable in our skin. But then, we deal with perimenopause issues, and that can really change things up for us.
Yep, absolutely. It
well,
can.
Why is it important to find that provider that can deal with those issues with you?
Sure, and it's important because I am going to tell patients, advocate for yourself.
Sure.
But you also have to have a provider who's going to advocate for you.
Yes.
And so having that, it comes from having a provider educated on hormone therapy, how to do it safely, and somebody who's taken the extra mile to do that. And that's something I'm really proud of with Premier U. That's a field that I've taken a lot of time to become an expert in because it was underserved.
Sure.
And I saw that in myself and my family. And, it's an area of medicine I hope to see grow more.
Well, we only get 3 minutes to talk about it on the show today, but I know that there's going to be more questions out there, more curiosity. Where can we drive people for some answers?
So visiting our website at premierufmarion.com is the best. That's got our phone numbers, got more information, and we can help guide people and guide women to feel better.
Well, I know that nobody's going to turn that away, especially whenever it's something as easily as having a conversation and potentially then taking the steps to deal with it. Well, Destiny, thank you for coming in.
Thank you for having me.
We appreciate it as always.